Hello viewers, I am Dr. Akbar Altaf from Dr. Akbar Eye Hospital, Hyderabad. Today I am going to talk about refractive surgeries. What are refractive surgeries? These are surgeries or laser procedures done on the eye to correct your vision and be independent of glasses or less dependent on glasses. Before we talk about refractive surgeries, we should know what are the common refractive errors in the eye. The most common refractive error in the eye is called myopia, where the image is formed in front of the retina. So, we use a minus power lenses to correct your refractive error to make the light or the image fall on the retina to see a clear image. The second most common refractive error is hypermetropia, where patients use a plus power lenses to see very clearly. Here the image is formed behind the retina, so use a plus lenses to make the image fall on the retina. The third refractive error is called astigmatism because of the difference in the shape of your cornea, wherein we use cylindrical lenses. And the fourth is the old age problem, where you have presbyopia, where patients have problem reading for near vision, where we use a plus power lens. And next is what are the various refractive procedures what we do regularly. The first and the most commonly done refractive procedure is LASIK, which can be done for moderate powers. For higher powers, we do a surgical procedure called implantable contact lens or implantable collamer lens. Now, what is LASIK? LASIK is laser assisted keratomiliosis, where the cornea is reshaped or modified to make the light fall onto the retina and so to see clearly independent of glasses. And the laser used in LASIK is called the excimer laser, which is a very safe laser and very precise laser. And now next comes, who are the patients who are eligible for LASIK? The first and foremost criteria is the patient should be above 18 years of age, and second most important criteria is the refractive power should not change over a period of 1 year. And the third most important criteria is your corneal thickness should be sufficient enough to treat the required power. And who are the patients who are not eligible for LASIK procedure are patients below the age of 18 years who do not have a stable refractive error over the period of 1 year and who do not have sufficient corneal thickness, and people suffering from dry eyes or autoimmune diseases are also not eligible for LASIK. Pregnant women and lactating women should also not undergo LASIK procedure. And next commonly asked question is, up to what power can we correct with LASIK? And when you take in myopias, the higher upper limit where we can correct is up to -8 diopters if you have sufficient corneal thickness, and in case of hyperopes or a plus power patients, we can treat up to +5, and astigmatism and cylindrical powers we can treat up to +3 safely if they have sufficient corneal thickness. As I said, the excimer laser is used to treat your cornea for your refractive procedures. There are different types of procedures done on the cornea depending on your thickness. First is photorefractive keratectomy or the PRK, where the LASIK is done on the cornea itself without a flap. So, this is done in patients who do not have sufficient corneal thickness, or in some professions as in like army, where they do not accept LASIK procedures. The regular LASIK procedure, wherein a flap is taken from the cornea using a automated microkeratome, or a femto LASIK procedure, where the flap also is taken by a laser machine. In LASIK or in femto LASIK, a flap is cut and the flap is raised away from the cornea, and the excimer laser is applied on the bed to correct your refractive error. And next most commonly asked question by patients is whether this procedure is painful and how much time does it take for it to complete this procedure. The excimer laser or the LASIK procedure is absolutely painless or very less painful procedure, and each eye would take around 5 to 7 minutes to complete the procedure. And the patient can immediately, it's a daycare procedure, the patient is immediately discharged, and in case of LASIK, the patient recovers almost immediately and they can resume their normal activities in 1 to 2 days. Whereas in a photorefractive keratectomy or a PRK, we place a contact lens after the procedure and the patient can resume their activities after 5 days. And the next thing is, why do most of the people, why do they prefer LASIK? The most common reason why they want to get LASIK done is for social reasons, for cosmetic reasons, or in some sports personalities where the wearing contact lens or glasses is a hindrance, or where other jobs. Yeah, like any other surgery, LASIK has its own share of complications, but fortunately the complications are not very severe and not vision threatening. The most common complication we come across in LASIK is a dry eye, which over the period of time, say 2 to 3 months, the patient comes back to normal by the use of good lubricant eye drops. The second most common complication is glare while driving at night, which is greatly reduced now with these modern machines. Most of these complications are well managed by medical treatment itself, and the infection rate is very less in LASIK surgery. As I said, LASIK has its limitations, wherein if the refractive power is above -8, there are different other procedures which are offered to the patient, such as phakic IOLs. LASIK is safe in patients who have a power of less than -8 with sufficient corneal thickness. In patients who have higher refractive errors than -8 and the thickness is not sufficiently good enough, then we advise what is called as a phakic IOLs, where a thin lens is placed in front of your normal crystalline lens. Lastly, let us have a look at the machines used for LASIK treatment. This is the regular excimer laser machine which treats your power, and the second machine here is called the femtolasic machine, where the corneal flap is cut without using a blade. So this is called a bladeless LASIK, and once we take the flap with this machine, then the patient is moved on to this excimer laser machine where your refractive error is corrected. To conclude, refractive procedures are the second most commonly performed eye procedures in the world after cataract surgery. Contrary to the belief that laser is very harmful, LASIK is extremely safe, the results are very satisfactory, and most of the patients are happy patients. Thank you.